We're going to go from a very general approach to a very specific approach on how to find a soft tissue restriction. Okay, so this is from the functional manual therapy approach. Greg Johnson developed this, and to start very general, we are just going to place our hands on the lumbar paravertebral muscles, basically. Okay, so this will be my first contact point, and I will push away from me, pull towards me, push up towards the head, down towards the pelvis. Okay, and just get a general idea of where it feels like it may not be moving. I will then move my hands over to the other side of the lumbar spine and do the exact same thing. So up, down, away from me, towards me. Okay, and what I'm feeling is it feels like as I push away from me, the hardest infill is somewhere underneath my hands here. All right. So, and what it actually feels like, it's more underneath my thumbs. So I'm going to go to one hand and push weight shift away from me. Okay. And then I just want to get an idea of, where do I feel like that starts? And really it feels like it starts somewhere right here on my third, fourth digits, the proximal portion of my third and fourth digits. Okay. So this technique is a general skin slide. Now we're going to go to a more specific, now we're going to go to what's called a finger glide. Okay, so if I believe it's right here, I'm actually going to take my fingers, they're going to be hooked like this, and I'm going to feel, if I slide across the surface here, where do I feel like that restriction starts? And right as I get to the other side of the spine, it basically indentions down right there. Okay, so now I'm like, oh, that is the edge of that infield. Okay, or that is the border of that infield, or what the IPA approach would call the leading edge. All right, so now that I found that leading edge, I want to see, is it purely away from me, or if I change my angle a little bit up versus a little bit down, which one of those has the hardest infield? All right, and for this restriction, it is hard going straight away. It is even harder, comes on sooner if I go down towards her pelvis a little bit in a way. Okay, so we've gone from general skin slide from two hands to one hand, right? And then we figured out where underneath the hand it felt like it was most restricted. I came off beyond that a little bit, then did the technique called a finger glide to find that leading edge. Once I find that leading edge, then I go to a specific skin slide, okay? And I found the angle of down and away, to where then I would start my functional mobilization, which is the cascade of techniques, which is the next video.